Hello, I'm Saad Dino, a pharmacist and owner of Acton Pharmacy and West Concord Pharmacy. I would like to welcome you to the second edition of the show, Healthier You. Our goal is to discuss relevant health topics and provide information that will help residents live healthier lifestyle. Today's topic is concussion, and I am very pleased to welcome Dr. Robert Cantu, a leading expert on neurosurgery and traumatic brain injuries. Dr. Cantu is the Chief of Neurosurgery and Director of Sports Medicine at Emerson Hospital. He's a clinical professor for the Department of Neurosurgery and co-director of the Center for the Study of Traumatic Encephalopathy at Boston University. Dr. Cantu also serves as a senior advisor to the NFL and many other sports organizations. And I welcome you, Dr. Cantu, to our show today. It's my honor and pleasure to have you on our show.
Thank you, Saad. It's a pleasure to be here.
Thank you. Please tell us more about yourself and the work that you do.
Well, I grew up in California and came back to Mass General to train in neurosurgery and went on the senior faculty there when I finished, and then eventually came out to Emerson, and now have kind of a foot out at Emerson for sure for a lot of years, and also kind of a foot back in town as well, mostly at BU. But also at Children's Hospital and Brigham and Women's.
Excellent. Many of us have heard of, or maybe even experienced concussions, but don't really understand what a concussion is. Can you please explain the causes of a concussion and what actually happens to the brain when somebody's concussed?
Yes, the word concussion comes from the Latin word concussus, which literally means to shake violently. And that's what's happening to the brain inside the skull. It's being shaken very violently, and it's being accelerated both in a straight line, we call that linear acceleration, and it's being accelerated in a rotational manner, and we call those rotational accelerations. And those accelerations on the brain stretch the brain tissue, both the neurons and their connection, called axons. And it's the stretching of that tissue that causes the dysfunction that happens with concussion.
And what are the purposes of neurons? What do neurons do? Just for the audience that...
Neurons conduct impulses, and depending upon the area of the brain, they have different functions. Neurons in certain areas of the brain, like the frontal lobe and the temporal lobe, are involved with memory and thought and processing information. Other parts of the brain, they're involved with balance or coordination or vision or speech.
Okay, perfect, thank you. Now, is there such a thing, I know my kids play sports and many other kids play sports out in our communities. Is there such a thing as a minor concussion?
Well, there certainly is a spectrum of severity of brain injury associated with concussion, and I think it's very important for treating physicians, if they don't use a grading scale with concussion, which is not essential to use to manage a concussion, but they at least write down in the medical record how long the symptoms last. And you're not going to know that on day one, because you don't know whether this individual will clear up with their symptoms within a matter of hours or days. Roughly 80% of concussions will have the symptoms clear within 7 to 10 days. But that other 20% will go on to more prolonged symptoms, and perhaps as many as 5 to 10% of that prolonged group will go on to very prolonged symptoms, what we call post-concussion syndrome, where symptoms have lasted more than a month, and in that group, individuals can have had symptoms that lasted many months and sometimes even years.
Years?
Yes.
Wow. Okay. Now, a common misconception is that you must lose consciousness to have a concussion. But that isn't true, correct?
No, that's not true at all, especially not true for athletic concussions. More than 90% of athletic concussions, there is no loss of consciousness. Rather, there are just simply post-concussion symptoms that occur in close approximation to the head injury itself.
So just losing consciousness doesn't necessitate a concussion diagnosis,
well,
or vice versa?
Anybody who's lost consciousness would have had a concussion.
Okay.
But the converse is not necessarily true. You don't have to lose consciousness to have a concussion.
Okay.
The majority of concussions do not have loss of consciousness. Just like the overwhelming majority of concussions occur when the head is being struck,
Okay.
either struck by another body part, like another head or a helmet or an elbow or a foot or a ball or the turf that you're playing on.
Okay.
But you don't have to strike the head to cause a whiplash effect and a shaking of the brain violently enough to produce a concussion. You can have a concussion from a blow to your chest that just snaps your head forward with such violence that you have concussion symptoms, or a blow to your back that snaps your head back with enough violence to produce concussion symptoms. Less common to have those indirect mechanisms, but they happen.
They do happen. Interesting. Doctor, can you describe some signs and symptoms of concussion?
Yes, they come in 4 baskets.
Okay.
One basket is the cognitive basket, where thought processes are slowed down. So we have difficulty with memory, we have difficulty with attention, we have difficulty with processing speed. And so individuals find that it's taking them a lot longer to do their homework, or they just can't do it at all. They just can't focus and concentrate the way they normally would. Or if they do read a paragraph, a few minutes later, they can't retain what they just read, as opposed to it being second nature normally.
Got it.
Second basket is the emotional basket.
Okay.
Commonly after concussion, we have people with anxiety symptoms, panic attacks who didn't have them before, and depression. Third basket is the sleep basket. And in the sleep basket are individuals who will be sleeping more than usual, and that's very common right after a concussion. People who will be sleeping less than usual and will actually have trouble falling asleep. And so you kind of have people on both sides of that sleep equation.
Interesting.
And then the biggest basket, by far, is the physical basket, or what we call somatic symptoms. And that includes the number 1 symptom of all concussions, which is headache, which is the most common, occurs in roughly 80%. But also lightheadedness, dizziness, and sensitivity to light, and sensitivity to noise. So that physical basket is by far and away the biggest, but there are these 4 different baskets of symptoms.
And you don't have to have one in each basket to be concussed.
No, you just simply have to have in close proximation to the head trauma the development of these symptoms. And the symptoms don't always occur, or at least are not always recognized immediately.
Okay.
Sometimes that's because they truly are delayed in their onset, like difficulty falling asleep. You're not going to know till the night of the concussion, or maybe a next day or two. But also because in the heat of the battle, with the adrenal glands pumping out adrenaline, you may not notice that you're a little lightheaded, or you're a little nauseated, or you have a little headache. But when you go to the bench, or after the game is over, or later that night, that's when these symptoms may be delayed in their onset, though it's usually the case that there are some symptoms immediately after the head trauma.
And again, it could come at any time, right? It could come the next day, could come in a week, as long as a month?
Well, if it's a month out, we would be very concerned there might be something else that happened.
Okay.
So normally the delayed post-concussion symptoms are going to come within a few days of the concussion itself.
And so this leads to my next question, Dr. Cantu. If somebody has a concussion, or they suspect they have symptoms of concussion, what should they do? Should they always seek medical help?
Well, I think it depends on the severity of the symptom side. Certainly anybody whose level of consciousness is impaired so that they're not able to concentrate fully, they're not widely awake, they're not making sense with their answers to questions, yes, those individuals should go to the emergency department or to their own primary care or pediatrician, physician to be checked out. So too should anybody with worsening headache, so symptoms getting much worse, especially if there's nausea, vomiting associated with it, and especially if it's acutely right after the concussion, because these are also symptoms of intracranial bleeding, and you not want to miss that.
Okay.
And so, generally speaking, people with impaired levels of consciousness, virtually anybody that's been unconscious for any significant period of time, anybody with any post-concussion symptoms that are getting worse, those are the people that ought to be checked out right away.
Okay.
People with very mild symptoms, or symptoms that are mild especially and are getting better, might wait till the next day in that instance. Not all those people need to be seen right away.
Okay. And I mean, I'm just from talking from, high school athletics, for example, those trainers are very well rounded in concussion symptoms, or seeking out those athletes that maybe have symptoms of concussion. So those students should feel, if they feel it during school, for example, and not when they wake up, they should be able to go to the trainer and seek some help, or the nurse as well.
Yes, absolutely. The certified athletic trainers are very competent in assessing concussion, and they're very good about referring on when there's concerns that this may be more than a concussion. It's important to understand that the initial immediate treatment of concussion is physical and cognitive rest. And so it's really not being seen by a doctor and the doctor making some intervention. The immediate being seen by a doctor, rather, is more if you're worried about something else developing, like a blood clot, something that could kill you if it's missed.
I understand.
So that's why individuals with concussion symptoms that are getting better don't necessarily have to be seen acutely.
Got it. Speaking of symptoms of concussion, what are the diagnostic procedures used or utilized to diagnose somebody with concussion, whatever range it may be?
Sure. Well, it's very important to understand that concussion is largely an invisible injury. There's not a blood test that makes the diagnosis of concussion. So you don't go to your doctor and like you had a fever and you get a blood test and the white count's high and say you've got an infection, or you do a culture and see a bacteria in your bloodstream. There's also not an imaging study that we routinely use, like MRI, regular MRIs or CAT scans that show a concussion either. So concussion is a clinical diagnosis.
Interesting.
And
okay.
the hallmark of making it is going through the symptom checklist.
Okay.
We talked about the 4 baskets,
Yeah.
26 total symptoms. Everyone needs to be looked for. We usually have the athletes or the athletes and their families fill out these checklists themselves.
Okay.
So you look for whether they have the symptoms that go with a concussion, and then you also do a neurologic examination.
Okay.
And you look for deficits that would fit with somebody who is concussed. And with concussion, the majority of the neurologic exam is usually normal. But the 3 areas of it that have a high likelihood of showing abnormalities are, first of all, the cognitive part of your neurologic exam. So you do what's called mental status testing, where you test memory, digits forwards, digits backwards, calculations in your head, remembering words at 0 minutes and 5 minutes, that kind of thing. Or you can do computerized neuropsychological testing, which is basically a cognitive test.
Okay.
The second part of the neurologic exam, not that you wouldn't want a doctor to do a complete neurologic exam, but the second part that's going to be of greatest likelihood to pick up abnormalities is the balance testing.
Okay.
And acutely after concussion, balance is often impaired. And we test balance with individuals putting their feet together, standing with their hands on their hips, eyes open, eyes closed. And then we have them stand in a tandem stance with one foot in front of the other, hands on your hips, eyes open, eyes closed, asking them to stand for 20 minutes in each of those postures. And then stand on your non-dominant foot, hands on your hip, eyes open, eyes closed. Most people can do that, should be able to do that.
Okay.
Very common that a concussed person cannot do that. And then the other area of the neurologic exam that has the greatest likelihood for abnormality is eye tracking movements. So we always have looking at their pupils to see that they're the same size. When the eyes move, do the eyes move smoothly or do they move in a jerky manner, which we call nystagmus? Is there any blurred vision or double vision with extremes of eye movement? There are also tests that can test for eye movement. One of the easier ones is called the King-Divik test, and many doctors use that test.
Okay. And again, that was just to make. You said you do that standing test for 20 minutes to make sure.
20 seconds.
20 seconds. I'm sorry.
20 seconds. Yes.
Okay, 20 seconds. Doctor, can you explain some of the complications of head injuries, specifically such as increased intracranial pressure or hydrocephalus?
Yes, certainly the most worrisome immediate worry is intracranial bleeding. And intracranial bleeding normally comes in two types. One is associated with a skull fracture of the temporal bone. And this temporal bone right here is a little more than 1/8 of an inch thick. It's very thin compared with the rest of the skull, which is much closer to 1/2 inch thick.
Okay.
If a ball, for instance, a hard ball like a baseball, strikes you right here because your batting helmet came off, it can fracture this bone, and in that bone there is an artery called the middle meningeal artery, and it will bleed, and it will bleed at an arterial blood pressure, 120, 130. So it bleeds fast.
Okay.
And that bleeding is inside the skull, but outside the covering of the brain. So that's called an epidural hematoma. Epidurals can happen pretty quickly. Over 15, 20 minutes, somebody can go from an awake, conscious individual to have such increased intracranial pressure from the accumulation of blood that one is unconscious and, quite frankly, if the blood is not removed very, very promptly, may die. Okay. So epidural hematomas can happen really quickly. They virtually always happen with a skull fracture, and the skull fracture virtually almost always happens right here in the temporal area, and that usually comes from that's where the blow was.
Interesting.
A much more common type of intracranial bleeding is the subdural hematoma. This occurs from venous bleeding, where veins have been torn and they bleed at a slower rate than an artery that would be torn. And so subdural hematomas normally progress more slowly over a period of hours. And they usually are not from a blow in this area, but from a blow to some other part of the head. Those two main types of blood clots, if missed though, can result in death. And so that's why if someone is having any deterioration in their level of consciousness or dramatic worsening of their concussion symptoms, especially headache, nausea, projectile vomiting, need to get them to an emergency department to be checked out.
And what diagnostic procedures do you use to look for those symptoms?
Yes, in the emergency department, the most important thing would be the CAT scan,
Okay.
which would show you and let you know whether or not there's a blood clot or not.
Okay. So we've spoken extensively about concussions and symptoms and the causes that may occur. What's typically, we alluded to it earlier, what is the recovery period of a concussion?
Well,
That's a tough question to ask, I understand.
Well, it is, but it's a very good question to ask, Saad, because what people need to understand is that concussion, like many illnesses, is a spectrum.
Yep.
On day one, you don't know how severe that concussion is going to be because you don't know how long the symptoms are going to last.
Right, okay.
So you shouldn't be grading concussions until all the symptoms have cleared.
Makes sense.
And generally speaking, we use a grading system that we devised some years ago in which the most mild concussion symptoms clear up within 30 minutes. The intermediate or moderate concussion symptoms last from 30 minutes to a week, and those that last beyond a week get in the severe category. But you don't know on day one how long those symptoms are going to last.
I mean, just from my experience, I know a young girl that lives in our town and the parents didn't know she had a concussion. And this is 13 months later, she still has symptoms of concussion.
Yes, unfortunately, as time has gone on, those individuals with prolonged post-concussion syndrome are kind of the majority of what I see in my practice right now. And it is very true that especially if the concussion has not been recognized so that it wasn't managed early on with optimal management, and by that I mean no physical exertion,
Yes. Yep.
no cognitive exertion. If cognitive exertion is exacerbating symptoms, it needs to be pulled back. And so all of the individuals that we see with a concussion acutely are all getting a letter that goes to their school outline what schoolwork they can do, at what level they can do it, and sometimes we start them at a given level and have to pull back from it, and sometimes, fortunately not extremely commonly, but sometimes we even have to take people out of school.
I've heard of that. I have heard of that. And speaking of our young athletes out there, whether it's high school or college, of course, they play competitive sports and they want to be on the field and they want to rush back. If you could just speak to our young athletes that may be listening to our program, Dr. Cantu, about how important it is to report symptoms and how important it is to take the time to speak to somebody about what their symptoms are, and as well, if you could just speak about how they could should take their time to allow their body and brain to recover from a concussion.
Yes, it's a great question, Saad, and the reality is that even today, where we use, generally speaking, that an individual needs to be asymptomatic first at rest, and then asymptomatic through a progression of a exertional program, which starts out with mild cardiovascular exercises, goes on to resistive exercises that are mild, goes on to sport-specific drills, goes on to scrimmaging in sport before you ever allow them to go back to playing a sport. So we have this asymptomatic first at rest, then asymptomatic with exertion, then we let people go back. We may, in a few years from now, be becoming even much more conservative than that, because there's electrophysiologic evidence as well as metabolic evidence that suggests even after the individuals become asymptomatic that their brain may not have necessarily totally healed. It's crucial that one not go back while symptomatic. Okay. To go back while symptomatic, the young athlete or old athlete puts themselves at risk for the second impact syndrome, which is a rare, fortunately, but highly fatal condition in which a second blow to an already injured brain can cause a loss of what we call vascular regulation of blood flow, and it leads to precipitous increased intracranial hypertension and herniation of the brain and death in many cases. Fortunately, that's rare, but what does happen very commonly is if somebody goes back symptomatically, takes additional trauma, sometimes even no additional trauma, just the exertion alone, greatly exacerbates the symptoms, and now takes an individual that would have cleared up within a few days and puts them in that post-concussion syndrome group of people with very persistent symptoms. So the athlete that goes back symptomatic is risking some serious issues, but is also risking a much higher likelihood that their concussion now is going to be made much worse and last much longer.
And those symptoms could last, as you say, longer. And how about long-term effects? Nobody knows.
We don't know about the effect of that on chronic traumatic encephalopathy, which is a later life neurodegenerative process that appears to be related not just to concussion, but to total brain trauma taken. So tens of thousands of subconcussive blows can have a very negative influence in terms of increasing your likelihood for developing chronic traumatic encephalopathy. And that's part of the reason why when we wrote the book, Concussion in Our Kids, we feel very strongly that our very young kids, especially those 5, 6, 7, 8, 9, 10, but even those under 14, shouldn't be taking head trauma if at all possible. And so the sports in which there is a lot of head trauma for those youngsters, we believe should be modified.
Now you're writing a book currently? Is that the book you're speaking of? Or this is I know you're writing a brand new book right now, which is your 30th, I believe.
Concussion in Our Kids is now out.
Okay.
And in this coming September, there will be a paperback edition of the hardcover that's already out with an additional chapter in it in terms of kind of what's happened in the last year. And in it, we present why we feel strongly that our very young athletes should be playing collision sports in a modified manner, such as no heading in soccer under the age of 14, no tackle football under the age of 14, no full body checking in ice hockey under the age of 14. We want people to play the sports. We want everybody to be physically active. We think more people will play, for instance, football, if you change it around to flag football for the 5, 6, 7, 8-year-olds at a very young age. Teach the skills of tackling, but teach them with tackling dummies. Don't teach them by bashing heads.
Okay. For more information on concussion testing, you could call sports medicine at Emerson Hospital, the rehab department at 978-287-8200. They have a lot of information that they could share with any individuals that need any information on concussions. Dr. Cantu, thank you so much for taking the time to be with us today and sharing your expertise.
Thank you, Saad. Happy to be here.
Thank you so much. Thank you everyone for tuning in, and I look forward to our next show. Be well. Thank you so much, Dr.